The restrictions imposed by COVID-19 are in some cases creating, let's say, extreme situations, especially when it comes, unfortunately, to those fatal cases. And that includes this one that was described to us earlier by Professor Chaim Birkenstadt of the Sheba Medical Center.
In this case, we are prepared to the situation that the patient dies and the family wants to say hello to the patient. Once again, because of safety reasons, they cannot reach the patient. So we have this aquarium. The body will be in this aquarium and the family will be able to see the body from the window. Once again, we will not force families to do it, but if the families will want to see the body, we will be able to provide this service for them.
Now, the large majority of fatalities by COVID-19 are coming among the elderly, and that makes geriatric care a crucial part of the medical response to this disease. Well, joining us now from Jerusalem is Amanda Clore. She is a geriatric nurse and program director of geriatric rehabilitation centers for Joint Israel Eshel. Amanda, thanks for joining us. And let me just start by just asking how the work of the geriatric nurse has changed just in the last month or two because of the onset of this pandemic.
Well, actually, it's really interesting because my work has drastically changed. I'm really doing as much as I possibly, we are doing, and I'm doing as much as I possibly can from afar, using technology wherever possible to provide the care that I would provide in person. I work in the community. I work in community rehab, and we've actually this week put a lot of our clients online to receive their rehabilitation care via Zoom medical.
But we associate geriatric care so much with hands-on treatment. Are there cases where nurses still have to go in there, and how are they dealing with the new reality of possible infection?
So there are cases when nurses are still going in. All of the Kupot HaCholim are still providing services where required in the form of home visits. But wherever possible, we are trying to provide as much medical care as possible using technology and from afar. And probably in about 90% of the cases, we can succeed to do that. A lot of it is about reducing anxiety, talking to the clients, making them feel like somebody's listening to them, making them feel like someone's there for them to hear their issues. And, you know, really at the Joint, we've put hours and hours of work in the last 3 weeks into putting as many services as possible online. And it's been quite successful.
Right. Amanda, a lot of the work of geriatrics is done in nursing homes. We've seen cases of infection in Jerusalem, multiple cases. Of course, one in Beersheba, more than a half dozen people there passed away. But a lot of criticism that the health establishment did not move, or the government did not move quicker to secure these facilities. What is the perspective from the geriatric nurses?
Look, I really cannot comment on your question, unfortunately, because I'm really not involved with nursing home care in this at all. All our focus has been on the community and on prevention, and we've been strongly encouraging our elderly in the community to stay at home, to follow the instructions as strictly as possible as they can, and to receive as much of the services that they can through technology.
Now, I just want to get a sense, unfortunately, we are seeing these fatalities come fairly quickly among the elderly or people in critical condition. Geriatric nurses, even from afar, that is a psychological toll, I imagine. How much a group like yours doing to help reinforce your own profession in this trying time?
We're continuing to work. We're continuing to be there for our clients. We're continuing to reach out. We're actually doing a lot of work. Instead of waiting to be approached by the clients, we're reaching out to the clients ourselves before they come to us and complain of an issue. We're actually doing regular contact with the clients, which often can prevent, you know, an emergency happening. And by doing that, you know, we're there for the clients just as much as ever, just in a different form. A lot of things have to take on a different form, and we explain to the clients that we're not doing this because we don't want to see them or we don't want to be with them or we don't want to hold their hand. We're doing it to keep them safe. And the clients have to understand that we treat multiple older people. They're one older person who, by staying home, is keeping themselves safe. But if we're treating multiple people and going in and out of their homes, we're actually putting them at risk. So you know, using technology is the best means, but being there for them, making them feel heard, seen, understood, and helping with their anxiety is the key.
Well, certainly. And of course, as you mentioned, the geriatric nurses have to stay healthy both for themselves and to stem possible further infection, which would be a very unfortunate situation. Amanda Clor there in Jerusalem, thank you for joining us.
Thank you and good evening.